Hello and welcome to COVID Conversations here on WNCU 90.7 FM, streaming on YouTube, Facebook, and Instagram. I'm your host, Kimberley Cartwright, News and Public Affairs Director at WNCU, and we're using the Zoom platform to talk about how COVID-19 is affecting our world. Today, health professionals are having a difficult time as they continue to care for patients who are not infected with the virus. They've had to adjust how they operate and are confronted with a lot of new hurdles. Midwives, in particular, have had to rethink how they can support pregnant women and their families. We're speaking with a midwife today. Tina Moore Braimah has made time for us through her busy schedule. She's the owner of Sankofa Birth and Women's Care in Durham. Hello and welcome.
Hi, how are you today?
I'm doing really well. I hope you're doing well.
Yes, except for this weather, but I'm doing great.
That's good. Well, I want to talk about midwifery. What in the world is that?
So midwifery is something that goes back to ancient times. It is a way of being with women and helping women through pregnancy and the labor process in a natural way for the most part. We pretty much believe that birth is a normal physiologic process and that women and families, I should say pregnant people and their families deserve personalized and individualized care. They deserve autonomy in their pregnancy and in their birth, and that they should be given decisions around what is done to their body.
So how did you decide among all the professions that you could possibly take up to become a midwife?
Well, goes way back. I started out as an engineer, actually, and I found that I was not fulfilled in that role, that I wanted to deal more with people and not so much with machines. So a series of events happened in my life that allowed me to first start working as a doula, working with low-income women in the Detroit area. And then I went on to apprentice with some home birth midwives with an Amish population in Michigan. And eventually we moved back to North Carolina. So I knew that if I wanted to serve women in the role or the capacity of a midwife, then I'd have to go back to nursing school so that I could become a certified nurse midwife.
So what's the difference? I'm sorry. You mentioned doula and then midwife. So what's the difference?
Well, a doula provides physical and emotional support to the client. She's there to give you all your data girls and to rub your back and tell you what positions to move into and those types of things. She is pretty much there to comfort the mother and to assist the mother in that way. A midwife provides medical services. We provide prenatal care. We actually deliver the baby, and we can provide postpartum care for you and your baby up until 28 days of life. So it's while midwives may do some of the things that a doula can do, doulas are not supposed to do all of the things that a midwife can do.
Tell me, how does what you do differ from what happens in a hospital birth setting?
Okay, well, I'm a little bit biased, but I believe that we have very personalized relationships with our families. We are selective about the women that we take. We want to make sure there's a really good rapport between me and the client and my assistants and the client. We want to find out what your needs are, what your questions are, what your fears are, and meet you where you are, as opposed to having a prescribed way of caring for patients. So we like to talk about the relationship piece. Having a home birth with a midwife requires a relationship in which we both trust each other. We believe that you're going to do what I say, and you believe that I'm going to do what's best for you and your baby. So in a hospital, you don't get to develop that relationship with your doctor. Oftentimes there are multiple providers in a practice. In my practice, there's just me, and we are a team of 4 people. So you're going to see us the whole 9 months of pregnancy. And by the time we come to your house, we're like family.
My goodness. I think I found my new calling. I want to be a doula.
Okay. So we can talk about that off air.
Thank you so much. I want to know, please, how do you protect the essence of midwifery? And you have to stay 6 feet away from your patient. Mm-hmm. And I would imagine you're behind a face shield and you have on your mask. So how do you accomplish like the personal touch that you were talking about just a little bit ago?
So for our practice, we are currently not wearing face shields, but we are wearing masks. We have made several changes in the way we do things. We are not behind barriers, as you would say. There's still a touch component to midwifery because we're not doing ultrasounds and things like that. We're using our hands to actually feel how the baby is positioned and how we feel the baby is growing, as well as using a handheld Doppler to listen to the baby. But the essence of midwifery has not left. We are still doing all the things that we would have normally done for our clients. We have staggered visits a bit. Some of our care is done virtually right now. So we might be doing a visit just like what you and I are having right now, except for the mom is given all the equipment that she needs, and we teach her how to measure her own belly. We give her urine dip strips so that she can test her urine and we can look for things that way. And she's also taking her own blood pressure. So in this way, we have empowered the mom to have more control over her care when we can't see her in person. So about every other visit is done in the office. We've also made limitations as to who can come to the office. So right now we're only allowing the pregnant person. At the birth, we're limiting how many people can be there. Whereas some of the local hospitals are saying, okay, you can just have one support person. We're allowing a support person, a partner, as well as a photographer, if that's what you would like. So in essence, we're keeping a lot of the same elements of midwifery that we would have had before. We're just having to put some limitations on that.
So what about testing for COVID? Do people have to test negative before they can come into your setting? How do you filter that?
So we do not provide testing here, and we are also not requiring any of our patients to get tested. We do, however, ask them questions the day before when we confirm their appointment, as well as when they get to the door. We want to know if they have any signs and symptoms of COVID. We test for temperature and fever. We ask if anyone in their house has been sick or had any of the signs and symptoms of COVID, of which we would lay out for them because some people don't know what the signs and symptoms are. And then if they answer no to those questions and they are symptom free at the time of the visit, including fever free, then they're allowed to come on in.
Tell me, what's the biggest challenge facing you and your clients in your home practice environment during COVID?
So I would say one of the bigger challenges before they even become a client is we are inundated with clients who want a home birth. People who would not have normally sought home birth now are avoiding the hospital environment, so they want a home birth. Honestly, because you're afraid to be in the hospital does not make you a great home birth candidate. So we are very candid with people about that. I think the whole idea that the partners can't be with them, especially first-time moms, they are not happy with us that we're not allowing their partners to come in. So we've offered some things like they're welcome to Zoom them in or, get them on the phone so that they can hear the visit and have some input and listen to the baby's heartbeat. The other big thing has been masks, like requiring everyone in the home to wear a mask except for the delivering person. And so we've gotten some kickback from people on that. They feel like I'm in my house. Why do I have to wear a mask? But it's more about protecting them than protecting us. Sometimes we leave one birth and come directly to another one. So you don't know what we're bringing into your home. Although we use, we're using personal protective equipment. We're doing hand washing and disinfecting and those types of things. This virus is very serious and it's passed easily. So, we want to protect them as well as protect ourselves and our staff so that we can continue to provide this care for other families.
So are you saying that you've seen an uptick in people wanting to do home births? And if so, you attribute that directly to COVID?
Oh my God, yes, there has been such an uptick. When COVID first hit the scenes last March to May, we started getting phone calls, like hundreds of phone calls every week like to the point that we couldn't even respond to everything. Things have died down a little bit more, and we've had to put systems and things in place so that we can control the number of clients that we're actually giving a meet and greet or an interview, and having to like screen people out more than we would have before.
So how do you know if a client is a good fit for you?
A good fit for me and a good fit for a home birth are totally different. So we want to make sure that we're checking their medical history. Do you have anything that would risk you out of a home birth? Because we do only deal with low risk clientele. Also, why do you want to have a home birth? You know, because some people, like I said, COVID's not a reason to want to have a home birth. A traumatic first pregnancy may be a reason, but may not be a reason. We have to talk about what happened in that pregnancy. And ultimately, if you meet all of those criteria, then it comes down to, are you a good fit for us personality-wise?
So tell me about some of the concerns that expectant moms talk to you about prior to a home birth during COVID.
So some of the big questions are, what do you do in a transfer? What if something goes wrong and I have to transfer? They want to know if we're going to come with them to the hospital. They want to know what hospital we're going to go to. And some of these things are questions that people have no matter if we were in COVID or not. But what COVID has changed is the fact that we cannot assist you in the hospital. I don't have hospital privileges. So what we do is we give report to the hospital. We let them know that you're coming. And typically before COVID, we would have gone in with you and stayed as like a support person or more of a doula role. But now that COVID's here and you can only bring one person at some hospitals, people often go for their spouse. And I totally understand that, you know, birth is intimate and you want the person that is closest to you there. But that has been one of the major changes in how we do things.
So another question, how do you go about protecting yourself from the virus?
So we, as I said, we're wearing masks. We're doing lots of hand sanitation. Sometimes we find ourselves taking showers here at the office and changing clothes. We're taking the same precautions that the general public is taking, with some additional cleaning and things like that in the office. Cleaning, limiting how many people can come into the office and our interface with people. We're requiring everybody else to wear masks. So it's not much different from what's happening, I would hope, in the rest of the world right now.
Okay. And what is it like when you see a person take their first breath after birth?
So it's surreal, honestly. The birth space is sacred, and you're looking at a transition from almost a transition between worlds. So when that baby opens its eyes or cries or sometimes grabs your finger, you know, it's undescribable. It's like something that I'm really privileged and fortunate and blessed and all those things to be able to be a part of.
Thank you so much, Tina Moore Braimah. And she is the owner of Sankofa Birth and Women's Care in Durham, North Carolina. We appreciate her so much. If you'd like to know more about her midwifery practice, you can go to www.sankofabirth.com. And thank you, audience, for watching via YouTube, Facebook, and Instagram, as well as listening to WNCU 90.7 FM. Be sure to like, follow, and subscribe to our pages to see more of our archived shows. I'm Kimberley Pierce Cartwright, your host. Until next time.